you want me to check it out? Okay.
In this video, we're going to go through some self-diagnosis techniques for your knee. We'll hit the ACL, the LCL, the MCL, Meniscus, Osgood Schlatter, Patella Tendonitis, all of the more common issues that you or your kids might be dealing with.
So stick around if you want to learn more.
Do you want to set up your kids for success in sport? Hi, I'm Nick. I have close to a decade of experience working in the field of sports medicine as an athletic trainer. I'm a certified strength and conditioning specialist, and I've worked with high caliber athletes who have gone on to the NBA and the NFL.
In this channel, we'll discuss topics such as injury prevention, injury rehab, and strength and conditioning, and how you can apply these to your kids. If you're a parent, coach, teacher, or just the cool uncle of some young kids, this channel is for you.
I believe it's important for all parents to have the knowledge necessary to set their kids up for success in sport, and I just want to do my part.
My part too.
You gonna do your part too?
So there's a lot more that goes into evaluating an injury, or specifically the knee, other than just the test itself. If you've ever heard of HOPS, HOPS, it stands for history, observation, then you have palpation and special tests. The history and observation itself, the majority of the time can lead to the diagnosis without even doing the test. So you have to take that into consideration. Was it a twisting force? Were you hit from the inside or the outside of the knee? Did you hear a pop? Did you hear a click? Do you have a history of a previous injury? These are all things to take into consideration, and again, just knowing the mechanism of the injury tells you a lot about what it could be. Patella tendonitis, or what they call jumper's knee, that's going to be pain right in the front, right on the tendon, between where it attaches the tibial tuberosity and the patella itself. One good way to test this is putting a weight strapped around your ankle, just extending out, and then lowering it down slowly. If you're having this pain right here, that'll be your patella tendonitis.
Now this is horrible form for a squat, but if you are squatting down with your knees far beyond your toes and you're having pain, that is an indication of patella tendonitis.
Now this next one is especially important for your teenage boys. If they're having pain right in the front of the knee, so this is your kneecap, your patella tendon comes down, where it attaches right here, they're getting a lot of pain here. They might even be getting that bump. That's something called Osgood Schlatter. Let me show you, for example, in my right knee, I had a very mild case of it. But in my left knee, I had it pretty bad when I was younger. You're gonna get this bump, and it's gonna be painful to touch. It won't go away. So what's happening here, as you grow and you get taller and your muscles get tighter, what's happening is your quad muscle is getting really tight, and it's pulling the attachment pretty much off of the bone. Every time it's pulling, more bone is building up to protect it. It's Wolf's Law. So years of growing and being tight and having that pull off the bone creates this bump. The good thing is that the pain will go away. Might take a couple years, but the bump will remain there forever.
Here we have a couple tests for your meniscus. It's the grinding force of the knee that is going to cause some pain.
So getting into a single leg squat and rotating can be an indication, and also the duck walk.
So you have 4 major ligaments in your knee. You have your MCL, your LCL on the outside, then you have your ACL and your PCL that cross each other on the inside.
Here are a few mechanisms for those ligament injuries. If you get hit from the outside of the knee, that presses the knee inwards, that's going to be a mechanism for the MCL. If you get hit on the inside of the knee, that pushes the knee outwards, you're going to have a mechanism for the LCL. And if you get hit in the front of the knee, where you hyperextend the knee, that's a mechanism for the ACL.
The ACL is what's preventing your tibia or your shin bone from sliding forward. So if your ACL is torn, your shin is going to want to slide forward. How this test works, softball works best. Put it right in the belly of the calf, and when you press down here, it's either going to, one, your ACL is there, it'll create the pivot, so your heel will come off the table. Or 2, if your ACL is torn, it won't be there creating the pivot, and it'll just let your shin bone slide forward and your heel will remain on the table.
So here's a little test for you. This is a patient I've had in the past. You have the left knee and you have the right knee. Comment down below which knee has the torn ACL.
So let's talk about your MCL. Your MCL is going to run on the inside of your leg, and it's going to help prevent your lower leg and your upper leg, so your tibia and your femur, from bending the knee inwards. If you bend your knee up a little bit, you can find where the 2 bones meet, right at the joint line, and if you put some pressure over that, it might have some pain. A test for it that you can do, I will show you on this leg. You're on a table. You go right to the end, so your knee is just over the table. And then you just let your leg relax. If you have an MCL sprain, this will be painful for you. Like I said, the MCL is preventing your lower leg from bending away from you. So gravity is going to want to pull that leg down, and then it'll put stress right on that MCL. So again, just put the knee at the end of the table, relax this way, and then see if you have the pain on the inside. LCL. This is going to do the opposite of what the MCL does. It runs along the outside of your leg, and it's going to prevent your shin bone from your femur from bending out. So again, with your knee bent up, you can find the joint line, and then you can put some pressure in there to see if you have any pain in here. And a good way to test this is to put this foot over this way. So this is going to put a lot of stress on that LCL. You can find the joint line and rub on it too. But if this is exactly where you're feeling the pain, then that would be your LCL.
If you have an ACL, what we're gonna do is you relax your leg. I'm gonna hold this here and take this leg, and I'm gonna see if it wants to slide forward. So, ready? Here. Slide forward. You feel that little clunk? You feel a little click? That's your ACL. And then, if I want to check the LCL, I'm gonna go like this. Right, that's your LCL. MCL is gonna be the opposite way, like that. You're very hypermobile. Right in here. You want your meniscus? We bend it up like this, and we take your leg, and we twist it around. And we twist it this way too. And then, if we want to see if you have patella tendonitis, go right here, and we press right in here. How does that feel? It kind of hurts. Okay. And right here is where it attaches.
That tickles.
That tickles a little bit. Thank you, baby.
Now, I don't want to discourage you from going to see your doctor, but these tools might give you an idea of what you're looking at before you see that doctor, that orthopedic, or get that MRI, just to maybe put your mind at ease. If you found this video helpful, then give it a like and make sure to subscribe for more videos in the future. If you want to see more videos like this, let me know in the comments down below.